and Health. I'm absolutely thrilled to welcome everybody here today to the Paul Farmer Symposium on Global Health Equity. Bienvenue tout le monde, nous bien content tout le monde là avec nous, soit ça qui là dans chambre ou bien soit ça yo qui sous line. Today we're celebrating the legacy of our friend, the physician anthropologist, professor at Harvard, visionary leader, Dr. Paul Farmer. We're joined by many of Paul's friends, colleagues here and around the world, and we're very especially honored to be joined by members of Paul's family. Welcome to Dee Bertrand Farmer, Katie Farmer, and Jeff Farmer. Thank you for being with us. We'll be considering and reflecting together as academics, practitioners, friends, on the impact that Haiti, her history, her struggle, her persistence, vibrance, innovation, and revolutionary creativity had on Paul's intellectual and moral understanding of the world. I had the privilege of knowing Paul and spending a lot of time with him in Haiti, thanks to Partners in Health and the incredible team, Zami Lasante, that he built there. And as I look forward to today's discussions, I wanted for just a moment to take you back to a moment in January of 2020. It's the lead up to the 10-year anniversary of a terrible earthquake in Haiti. I'm chatting with a Haitian colleague. We're waiting for Paul to come for dinner. He's late. There are some heavy feelings because of the moment on the day that's in it. And then one by one, different team members start arriving, each individually coming for their private appointment with Paul, because he has separately invited many different people to meet with him at exactly the same time. So rather than 10 different meetings, he creates a warm and engaging, heartfelt gathering of our team. And Paul is just beaming. But an international journalist is also there, and they thought that they were having a one-on-one sit-down with Paul to talk about some insights from him on the challenges that Haiti faces 10 years on from the earthquake. So here's the point of the anecdote. Paul is resolute in his replies to her very insistent inquiries. He doesn't want to be the inspiration for a story of the failures. He seems mildly irritated, but ever charming. He says, well, you could write about the first public hospital that we have built in central rural Haiti. I can imagine a story about our medicine residency program that just got accredited. Or, Haitians are leading so many of our programs all around the globe. He's replete with ideas of the successes and the innovations, and he is sure, absolutely sure, that they should be the lead. Haiti inspired Paul, and it seems to me that today it's going to do really great justice to exploring and sharing the reasons for that inspiration, and we welcome you all into that exploration and discussion. And it is now my true honor to introduce the president of Harvard University, Claudine Gay. In her inaugural address this year, President Gay shared her vision for a vibrant, diverse university community ready to meet the world's most pressing challenges with courage. Prior to becoming president, she spent 5 years as Dean of Harvard's Faculty of Arts and Sciences. President Gay is a leading scholar of political behavior and issues of race and politics in America. She is founding chair of the Inequality in America initiative. She first joined the Harvard faculty in 2006 as a professor of government, was appointed professor of African and African American studies in 2007, and named the Wilbur A. Cowett Professor of Government in 2015. In addition to her many university duties and her scholarship, President Gay has also powerful ties not only to global health work, but to Haiti in particular. She has supported Partners in Health for over a decade and was a close friend of Paul's. We are ever so grateful that she is here with us today. Esteemed guests, please join me in welcoming the 30th president of Harvard University, Claudine Gay, to the podium.
Thank you, Louise. And that's the first time I've heard you speak Creole, but now I know, and I can't unknow that. So thank you all. I'm really just so pleased to be here and to just add my welcome to all of you, and then just take a moment to reflect on the subjects of today's symposium. So as Louise mentioned, Haiti is my parents' beloved homeland. My mother, Claudette, and my dad, Sony, left Port-au-Prince and emigrated to the United States in the late 1960s, along with many of their siblings. And they had been childhood sweethearts in Port-au-Prince, but they emigrated separately, but both made their way eventually to New York, where they reconnected, married, started a family, and built a home that was infused with Haitian culture. So throughout my childhood, we moved a lot. We moved from place to place, following on the heels of my dad and his engineering career. By the time I left for college, we had lived in 9 different cities. And in each of those places, the world outside our house was the world outside our house, but the world inside our house was Haiti. Banan Posé, Compa, and Creole. And when I left for college, I discovered that Haiti was not only an important part of who I am, but also an important part of what I wanted to do and to understand. And it was Haiti and its complex existence through time that inspired my academic pursuits and pulled me toward the social sciences. And I also carried Haiti with me when I began my Harvard journey as a graduate student, arriving in Cambridge with my family's high expectations and my mother's cast iron skillet for frying banan. And so this is all to say that Haiti is very dear to me, and I've always admired Paul Farmer and supported Partners in Health because of that fact. As president, one of the things I hope to achieve for our university is connecting us in new and expanded ways, both among ourselves and also with society, and encouraging everyone who is part of this institution to ask why not as eagerly as they ask why. Paul Farmer was a why not thinker par excellence. Partners in Health is a why not organization par excellence. Why not deliver health care to those who need it most? Why not consider all health, physical, mental, emotional, social, when treating patients? Why not combat injustice wherever it exists? For me, these are some of the ambitious questions that our university must answer if we hope to fulfill our promise. And I want to thank you all for showing us how it's done. The courage to listen, to collaborate, and to grow is the kind of courage that changes the future, and I'm deeply grateful for your efforts. Paul continues to inspire those of us who are gathered here today, and of course, countless others around the world, to strive for justice. And I can't imagine a more meaningful, powerful legacy. So I'm honored to welcome you, but more importantly, to wish you well in this work. Thank you.
Thank you, President Gay, for sharing that story and for those inspiring words. I'm Joe Rigney, and I serve as the chief of the Brigham and Women's Hospital Division of Global Health Equity. Before I introduce Anne, I was asked to share a brief reminiscence about Haiti's influence on Paul. I first met Paul 30 years ago when we were both internal medicine residents at Brigham and Women's Hospital. We became quite close during a rotation at the then inpatient wing of the Dana-Farber Cancer Institute, when I was one of the junior residents on the team and Paul was the ID fellow. We shared a small workroom, and we were both often in it in the afternoons, which, as most of you can probably imagine, led to a lot of what Paul would call chatting. Among the many subjects that came up during our chats was liberation theology, which I had been exposed to right after college when I spent a year in the Jesuit Volunteer Corps, living in community with several Jesuit priests on Manhattan's Lower East Side. I remember asking Paul once how he learned about liberation theology. And he replied with that endearing, smart, alecky grin of his, from the Haitians. Paul told me a lot about a great many things that month. I even learned a little bit of infectious disease. In one exchange I remember vividly, I was struggling with understanding what option meant in the phrase option for the poor. And Paul just getting completely exasperated with me and saying, it means to choose to stand with the poor, to see the world through their eyes. Near the end of the rotation, I found an inscribed copy of AIDS and Accusation laying on my call room bed. I confess that it took me a few months to start to read it, but when I did, I was stunned to encounter this confident, authoritative narrative voice. A voice that described with such nuanced detail the suffering of ordinary Haitians at the hands of both HIV and an oppressive political economic system. Paul weaved together the personal histories of the people of Do-Kai, Kanj, with the larger history of Haiti in a way that both illuminated and outraged. He showed how the epidemic of HIV in Haiti was neither an unfortunate accident nor a self-inflicted disaster, but rather an inevitable result of centuries of oppression, tyranny, and neglect. And Paul never presented this as one version of the story. It was the real story. All the other versions purposely obfuscated the truth. It was unlike anything I had read before. I remember at various points in reading the book, thinking back to moments in our previous conversations and realizing, oh, that's what Paul meant. Now I get it. Paul always viewed the world through the eyes of the most destitute and interpreted everything through that gaze. He always credited Haiti with teaching him that skill. And that's also where he first found his voice. I still occasionally get little epiphanies of understanding when remembering something he said. And despite his absence, I still cannot unhear that voice. A voice that, while always full of compassion, was often full of outrage. A voice that, dripping with affection, could chide, cajole, or instruct. And a voice that always spoke the truth, so clearly, so insightfully, and with such deep reverence. Thanks. So I'd like to introduce Dr. Ann Becker, who is going to be moderating the next panel. Dr. Becker is the Maud and Lillian Presley Professor of Global Health and Social Medicine at Harvard Medical School, and she's also the Dean for Clinical and Academic Affairs. She was a dear friend of Paul's who served as the Vice Chair while he was Chairman of the Department of Global Health and Social Medicine. Dr. Becker graduated from Harvard College, summa cum laude, and received her MD and PhD in anthropology from Harvard. She completed her residency in psychiatry at Mass General Hospital. She is an anthropologist and psychiatrist whose research examines eating disorders, social barriers to care, and school-based mental health promotion. Both Dr. Becker's clinical and research work have been widely influential. In addition, she has received several awards for teaching, for research, and for institutional service to Harvard. Ann.
Thanks so much, Joe. And good afternoon, everybody. Welcome to the first panel discussion this afternoon, titled Haiti's Impact on Paul Farmer. Before I introduce the panelists, I'd like to begin by saying something about the common thread that led us all to be seated here to speak on this panel today. Each of these three panelists has a story to tell about Paul's early engagement with Haiti, and in those stories, insight into the profound and transformative impact Haiti had on Paul. Also, the impact Haiti had on Paul's work and of course on his enduring commitments to health and social justice. In reading Paul's scholarly work from the vantage point of 2023, it is impossible not to see that Haiti is always the reference point and inspiration for his ideas and commitments. But each of our three panelists, Hans Saucy, Arthur Kleinman, and Ludwig, also had a prospective view as this impact unfolded in Paul's early career, indeed while he was still a student. And in that respect, each of the panelists has had an unparalleled front row seat to what may be viewed in hindsight as pivotal moments that set a trajectory for not just Paul's scholarship, but also toward his commitment to health equity and what became what we all see now as the through line and legacy of Paul's work. I first met Paul in the fall of 1983 when I was a first-year student here at HMS and Paul an applicant, sent to talk to me by Arthur Kleinman because we both hoped to pursue an MD PhD in medical anthropology. That meeting made quite an impression on me, not least because Paul arrived carrying a large cardboard box full of photocopied journal articles as a gift. Yes, really. Which to this day has remained one of the most unusual hostess gifts I've ever received. And also probably one of the most thoughtful, because the papers reflected our shared interest at the time in cultural psychiatry, and I came to see this gesture as a harbinger of Paul's intellectual exuberance and generosity. That meeting was also memorable in other ways. I felt transfixed by Paul's clarity of purpose and the velocity at which he was moving toward it. It intrigued me and I wanted to understand it better. A year later, I began to, via our many conversations about our respective experiences in Haiti, and then when we were asked to write side-by-side pieces reflecting on those experiences. Since I doubt that the 1985 spring issue of the Harvard Medical Alumni Bulletin remains in wide circulation, I wanted to share something in Paul's own words from the copy I've kept on my bookshelf. Paul's article, The Anthropologist Within, is an early look at Haiti's foundational and transformative impact on Paul and on how he sought to repair the world. In some respects, the piece was a declaration of admiration for Haiti. He wrote with zeal and great affection, packing in lessons for readers on Haiti's history and paying homage to the remarkable Pierre Lafontaine. He wrote about Haiti as a country, in his words, quote, culturally, linguistically, historically, it must surely rank as the most fascinating. It is also evident that by then, Haiti was in his heart. He said things like, Haiti, my time in Haiti is etched deep in my memory, and presciently, I hope continued fieldwork will confer the thorough understanding of Haiti that I seek. Paul also used this article as a sort of meditation on the central dilemma he saw on the purposes and constraints of anthropology. And in referring to what he called an idée fixe, he did some verbal hand-wringing about the conventional boundaries between ethnographic observation and pragmatic action. The bright line he saw between understanding and describing health burdens and then launching the much-needed interventions to remedy them. He wrote in that 1985 article, quote, this then was my dilemma. Was my primary role to be that of an observer or an intervener, end quote. Paul equivocates, but not for long, and not really, because by the end of the same paragraph he announces, quote, circumstances forced me to abandon a neutral stance, unquote. We see that the neutral position was never a live option and only ever a straw man for Paul. And the piece revealed itself as a call for action, or perhaps better put, a rebuke of inaction. And in his idea, Paul's idée fixe, germinated in Haiti, the readers, including his classmates, saw a person and a path to follow. And now let me turn to our panelists and ask them to share some reflections on on Haiti's impact on Paul. And I'd like to say a few words of introduction about each of them, and then ask them to speak in chronological order of having been a witness and a collaborator at the intersection of Paul and Haiti. And that would be Hans Sassi first, then Arthur Kleinman, and then finally Louie Viaud. Hans Sassi is university professor at the University of Chicago, teaching in the Department of Comparative Literature and the Committee on Social Thought. He's the author of many books on comparative literature, translation, and Chinese poetry. But his proudest accomplishment is editing Partner to the Poor, a Paul Farmer reader, which came out in 2010 from University of California Press and is now in open access. He's planning a new book that will document the after effects and side effects of the Partners in Health model of accompaniment wherever PIH is engaged. Arthur Kleinman is the Rabb Professor of Anthropology at Harvard and Professor of Global Health and Social Medicine and Professor of Psychiatry at Harvard Medical School. He was Paul Farmer's PhD supervisor and close friend. Arthur will talk about the early impact on Paul Farmer of his lived experience in Haiti. And he will talk about how Haiti formed Paul from his originating interest in cultural psychiatry to his abiding work in medical anthropology and global infectious diseases. Arthur also taught a seminar last spring, which read the canon of Paul's books, and we'll talk about how Haiti figures in Paul's intellectual trajectory as a major scholar. Louie Viaud is the Chief Gender and Social Equity Officer for Partners in Health. Louie was one of the first employed by Paul in 1988. And she'll talk about the early days of Partners in Health, her friendship with Paul, and Haiti's impact on Paul. Han, please.
I first met Paul at Duke. Sorry, forgot about that. I first met Paul at Duke in 1979. We were both undergrads of a somewhat nerdy cast, and therefore odd ducks at a school where sports and fraternities set the tone. I was fresh from a high school year abroad in France and had been reading all the structuralist anthropology and linguistics I could get my hands on. Lévi-Strauss, Benveniste, Jacobson, Barthes, Kristeva, and also Foucault, Althusser, Deleuze, and Derrida. Paul knew this stuff too, but he wasn't as impressed by the elegant ballet of signifiers as I was. Our teacher, Weston Labar, was an eclectic structuralist, adept at handling networks of meaning and also warmly curious about the lives of the people he studied. Through Weston, Paul got to know the ethnopsychiatrist Georges Devereux, a builder of theories with an astonishing range of on-the-ground experience. Devereux had lived and worked as a therapist among Native Americans and mountain peoples of Southeast Asia, as well as practicing and teaching in major U.S. hospitals. His work made a deep impression on us because of its respect for the dynamic of transference and countertransference. In other words, the ways that the person being observed influences the observer, and the observer influences what is observed. At that moment in his life, I think Paul was expecting to train as a psychiatrist and work with indigenous populations somewhere in the world. Fresh horses. But Devereux was too ill and frail to take Paul on as a student. That turned out to be a providential dead end. For another part of Paul's omnivorous reading in French anthropology had led him to Haiti. In ethnopsychiatry, there was the great book on Haitian Vaudou by Alfred Métraux. Métraux had been close to the surrealists I was reading, André Breton, Michel Léris, Léopold Sédar Senghor. And from that group, it was a short step for me, under Paul's tutelage, to begin reading Haitian writers like Jean Prismars, Jacques Roumain, Jacques-Stéphane Alexis, René Depestre, Jean Métellus, René Bélance, just to cite those who wrote in French. He met Depestre, Bélance, and Métellus and interviewed them for a book we were planning to write together, 3 Haitian poets, selected translations, and an introduction. That book never happened as such, for reasons having to do with the timidity of American publishers and our being total unknowns, but parts of it eventually leaked into print. Paul went to Haiti after graduating from college. The year was 1982-83, coincidentally the year that a mysterious and fatal autoimmune syndrome began to be reported amongst gay people, blood transfusion recipients, and Haitians. A collection of categories that was random, but somehow not random, if you thought less about causality than stigma. There he came straight up against the limits of what was known as charitable health care in a profoundly impoverished country. Patients were turned away from hospital doors for no reason but lack of funds, and other patients were given useless diagnoses, prescribed treatments they could never access. Tracy Kidder has written memorably about one night of desperate frustration in a hospital that was poorly set up to do its job. So Haiti announced to Paul in the starkest possible terms what the problem was. The problem was what he would later call medical nihilism. And Haiti also brought Paul the vision of a solution. When I went to see Paul in the spring of 1983, he had just moved from a room in Port-au-Prince to the town of Mirebalais, where he was living with the Lafontaine family. Father Fritz Lafontaine was the incarnation of the preferential option for the poor. Père Fritz and his wife, Yolande, whom we called Mamito, chose to live among the squatters in the mountain village of Cange, people who were badly off even by Haitian standards. Père Fritz leveraged ecclesiastical connections with the Episcopal Diocese of South Carolina to bring doctors and dentists in for short clinical visits. Built like a football tackle, a theologian of great insight, Father Fritz saw no reason Central Haiti should not have its own well-equipped, well-staffed, and free hospital, ringed round with outreach services and social benefits. Nobody in Cange or Mirebalais disagreed or called him unrealistic, at least not in my hearing. His utter conviction inspired and guided Zami Lasante, the original core of Partners in Health. HIV, hurricanes, earthquakes, coups, murders, kidnappings, and other heartbreaks, nothing could divert the équipe solide of Zami Lasante from their path. The successive challenges, and let's put aside modesty, victories of PIH, which I trust will go on until there is no more need for them, all grew out of that encounter. Paul's passion for Haiti was infectious, and his engagement was total. I don't know what would have happened if Paul had gone somewhere else after college. By now, it is impossible to imagine Paul without Haiti, or, I think, Haiti without Paul. Thank you.
Thank you so much, Han. And Arthur, please.
If you can put up that slide of mine. This is one of the letters that Paul wrote to me as an aspiring young medical anthropologist when he was at Duke University, and very much wanted to be, well, to be frank, Arthur Kleinman, okay? Paul was committed to psychiatry and cultural studies about psychiatry and mental illness and the whole set of ideas that bring mind, body, and society together. Something radically hit him when he went, something radical hit him when he went to Haiti for the first time. I believe the best word for it is shock in multiple systems. It was an intellectual shock. It was an affective shock. It was an existential shock. So important was this visit to him that I think it remade his whole idea of what the world was about, what he was about, and where he would go. If we want an equivalent of how important that visit was, we'd have to go to the book of Job in the Bible, where Job uses the term, the Aramaic term, ka'as, to express what was happening to him. Ka'as means shaken, to be shaken by a powerful external force, something different from you, apart from you, yet making you feel it. Actually, there's a Chinese word that Juan and I know, fanzao, which means exactly the same thing. It means to be shaken by an external force. And this is what the experience of poverty, deep poverty, of people enduring with joy and sadness, hope and disappointment, fear, anger, and the desire to do better. This impact on Paul, in my view, set his intellectual, emotional, clinical, and spiritual future. He made an identification. He made an identification not alone, but with others. Jim Kim, Ophelia Dahl, other foreigners. Hi, Jim. Were there to join him in this, as was his family and his great friends, his great Haitian friends. But this would come to so preoccupy him that he sought the words and the ideas that could put this experience into movement forward, to mobilize it in the battle against poverty, illness, and the terms that he either found and reworked or invented himself included social suffering. The idea that suffering is not limited to a single person. Structural violence. The idea that being deeply poor, without resources, and exposed to the dangers and uncertainty of the world was a violence. The idea of socialization for scarcity, his great criticism of public health. That public health, in the endeavor that Juan referred to, the HIV/AIDS epidemic, that public health had served poor people badly. It had said, rich people can have treatment and, as treatment evolved, and prevention, but for the poor, prevention only. Paul totally rejected that. And that led him, I think, to his great identification with social medicine. Paul was well trained in biomedicine, but for him, social medicine meant that social inequality and health inequality were inseparable. Social policy and health policy needed to be done together. And he had before him Haiti as his example of where these things would be done. There was an incredible gift that he had, that in the hundreds of PhD students and postdoctoral fellows, thousands of undergraduates I have never, ever seen its like. And that was his ability to move from theory to practice in the most practical of ways, with humor, with inspiration, with charm. He needed charm because he had to raise the funds, and he was good at raising the funds. But also with the deepest humanity. As you heard, I taught a course on his work last spring. We spent a lot of time on how important Haiti was for Paul, and how important Paul was for Haiti. Paul Farmer was an extraordinary individual. I believe he was a world historical individual. I'm sure that Didi could tell me that that he had feet of clay, as others would. We all have feet of clay. He changed the world. And in changing the world, he made Haiti, not just Haiti's poverty and today political unrest and chaos almost, but Haiti's possibilities, Haiti's hope, Haiti's example as the first Black republic of a future in which, as he would put it, no one is considered lesser. Thank you.
Thank you so much, Arthur. And Loon, may I invite you to share, please?
Good afternoon, everyone. It is an honor for me to share.
Maybe this one?
It is an honor for me to share the stage with such great panelists. Let me start by saying thank you and my sincere gratitude to the steering committee for thinking about Paul and Haiti. Paul would have loved that, as we all know. The story of Paulo, as we affectionately call him in Haiti, and Haiti, is a love story. Before I begin, I would like to say hello to Paul's family, Didi, Jeff, and Katie, and also acknowledge Paul's larger family here with us today, his many students, patients, and collaborators with us physically and virtually. Thank you all for joining this celebration of a very special person who cared deeply for millions. Paul's love of Haiti and its rich history was obvious to all. Haiti is the reason that I met Paul. I remember the evening of 1988 when Paulo and I met and formed a partnership for the ages. We were introduced by two great friends, Amy Willens and Cathy Matenoska. My first encounter with Paul was kismet. We spoke for hours. Or should I say, Paul spoke for hours. And I listened. Occasionally, he let me say a few words or two. I listened in disbelief how a blanc, which is a foreigner, as we call, as Haitian call, could know so much about Haiti, and how a blanc could love Haiti that much. Paul's Creole was immaculate, which helped giving, I did not speak English at that time, and we connected right away on social change, sexual violence, and our Christian faith. We were both Catholics, and we spoke about our moral commitment to make the world a better place, especially for the most vulnerable. Paul wanted the world to know the extraordinary role Haiti and our Haitian colleagues played in pioneering and practicing global health equity. When I met him, he was already an advocate for the poor, an advocate for the Haitian people. I remember thinking, I had never met anyone like him, and I never would again. Paul was one of a kind. We immediately agreed on the right to quality health care for every single person, regardless of their place of birth, educational level, job status, or income. We spoke about the need for every person to be treated by caring, compassionate healthcare providers trained in world-class facilities and who spoke the same languages as the patient and who understood that patient's community. We did not think that it was a radical idea. We thought it was the thing to do, period. working with Paul from the day we met in 1988 and until the evening of that Sunday, hours before he passed away, was the best relationship I ever had. I remember at the restaurant when we, in our first meeting, he drafted a work contract, in Creole, mind you, on a napkin for both of us to sign. Basically, the contract said that we both will work tirelessly for social justice and serve the most vulnerable until we die. P.S. He will find the resources we require to make it work for all of our patients. Paul was then the executive director of PIH, and so he offered me the job on the spot. And I started to work the next day. I remember that we were only 4 people at the office in Cambridge. I'm looking at Jim in Central Square. So Paul shared a list of patients I needed to visit at the Cambridge Hospital. PIH had a car, the yellow car, and Paul gave me the key and said that I need to go visit the patients, and I need to be, we didn't have the word accompagnateur then, but it was like to do whatever they asked me to do, I need to do that for them. So I think that was probably the birth of accompaniment model, which is an open-ended accompaniment, Paul would say. Paul was Haiti's greatest ambassador. He made sure that everywhere he went, Haiti was front and center. I will bet that everyone who met Paul learned something about Haiti. Paul was more Haitian than most Haitians. His last trip to Haiti was after the Mos earthquake. We traveled to the south and visited many patients in Lecaille, which was Lecaille, and Saint Boniface in Fondé-Blanc. I miss Paul every day. I still find myself to this day thinking of calling Paul with a challenge, and then realize that I cannot call Paul anymore. He's gone. But I rejoice that I had the privilege to work with him for so many years. I feel lucky to have known him. Haiti opened Paul's eyes to everything that was wrong in this world, the injustice of this world. Haiti had such an influence on Paul, and we Haitians were lucky to have Paul early on, spending a lot of time in Haiti before he became famous, but still, whenever he had a few hours a day, he would travel to Haiti. Paul brought the voices of everyday citizen living in small, remote communities to every corner of the world. Paul took the lessons learned in Haiti to the world. He will tell you that some of his great teachers, Harvard and Duke, were Haitians. And while I know that Haiti has seen many tragedies and struggled with social justice, political and economic challenges, Haiti is the model of care for all of partners in health. The global health equity movement started in Haiti. Paul made sure of this. Today, we can say that thousands of Haitians have access to a better life because of Paul and the teams he trained and mentored. Because of this unconditional love, tens of thousands of Haitians have received training, learned skills, accompanied their neighbors, held a dying person's hand, are employed, and are able to care for their families because Paul believed in their education. He believed that everyone deserves the chance to live a decent and good life. Thank you again for the opportunity for me to honor and talk about my great friend and mentor, Paulo. Paul remains in my heart and my everyday actions. Merci un peu.
Thank you, Loon. That was lovely. And we have a few moments for maybe a quick round of questions. Maybe Han, I'll start with you. Haiti, we've all been hearing about how Haiti was a point of reference for Paul, a platform for Paul's work, an active partner in Partners in PIH's efforts to broaden access to healthcare in different communities around the world. Was this, you knew him first, was this part of his plan, or did it just unfold in that way?
I think it just unfolded. He knew that he wanted to go where things were hardest. And to tell the truth, if anything impossible, if anything unsurvivable is about to happen, the Haitians will get it first. Diseases, natural disasters, political disasters, adventurism, just, every kind of crazy thing happens to the Haitians. And Paul felt deep solidarity with people who were enduring and somehow managing to get up and fight on for their lives every day. So it was, it's not the only place where that happens, of course, but maybe it's the place where he sensed it happening most intensely and most durably.
Well, thank you for that reflection. And I'm thinking about what a difficult place we all knew it was for Paul to work. And Arthur, I recall when Paul was working in Haiti, Leon Eisenberg used to worry about him quite vocally. And I'm wondering, did you worry about Paul in that way, about his safety? And maybe I should ask, did you worry about Paul making it through his PhD? Did you think he would take a turn and not finish it?
Well, Anne has loaded this question for me because when Paul took his MCATs to get into Harvard Medical School, he had a fever of 106 due to malaria. And so his MCATs, while still good, were not at the level that they would have been if he hadn't had malaria. And so Leon and I wrote a very strong letter to the then Dean of Admissions about how fantastic Paul was, and just simply pointed out that had the dean ever seen a student take the MCATs when he had a fever of 106 and had malaria. Fortunately, Paul got in here, but the story I want to tell is the following. As an anthropology student, Paul and Jim let me know that they, together with Ophelia Dahl, were going to found an NGO. And I said, don't do it, okay? Do it after you have finished your PhD, okay? Because these were medical students in a new program, an MD, PhD program, and they needed to finish. Well, there was no fear of Paul finishing. Paul handed in a dissertation of 800 pages. The anthropology department put in a policy as a result that that no dissertation could exceed 400 pages, okay? So even though we heard from Joe that reading Paul's first book, AIDS and Accusation, was an important read, I can tell you that it would have been a much more difficult read if all 800 pages of his dissertation had found the way there. Yeah, we were concerned about Paul and Jim and Ophelia and everyone else who was engaged in this. But Paul made some things clear that I think have deeply affected all of us who worked with him, so that we started as his mentors and he became our mentor. One of the things that Paul said was that when you're with a patient, or when you're with someone who needs your assistance, their suffering counts more than your suffering. He had the view that you find yourself as a human being, not by going into yourself deeply, as the silly pop American psychology says, but by going out and serving others. That's how he found himself. That's how he helped us find ourselves.
Thank you, Arthur. And I'm just trying to imagine MCATs with a fever of 106. Loon, I think I'm going to send maybe the last question of this panel to you. I'm thinking about in many ways you were both a collaborator and a navigator for Paul in Haiti. And I'm wondering if obviously Paul left this earth too early. I'm wondering if you felt that Haiti had more to teach him, that there was anything left unsaid or undone, in your view?
Yeah.
Wow, and that's a tough one. I think, I'll tell you how I feel that, and I know some of us here, and I talked to Didi many times about this, is we Haitian in Haiti, and I don't know what Michelle is going to say, but we didn't, if there was one regret, that we didn't recognize Paul enough nationally in Haiti. We wanted to give him a Haitian passport, for example, and we work on that with the late President Jovenel Moïse and his team, and we were going to surprise Paul and have a ceremony for him at the palace in Port-au-Prince and give him the Haitian passport, but he was gone too soon, and the President Jovenel Moïse was assassinated, as we know also. So I feel like it is an unfinished business for me as Haitian, and again, I know some of my colleagues in Haitian, they feel the same, that Paul was gone too soon. But I said, only God knows, so we will never know. But God knows. I don't know if I answered the question.
You answered beautifully, Loon, and thank you for that. And I see we're running up against the clock, so we need to bring this panel to a close. I want to thank each of our panelists, Han, Arthur, Loon, for this extraordinary conversation, for your deeply moving recollections of Haiti's profound, transformative, and enduring impact on Paul. In hearing these stories, it becomes even clearer how the seeds of Paul's dedication to social justice, to health justice, were sown not just in his early encounter with Haiti, but also in his committed posture as a student of all things Haiti, the source, as it were, of an idée fixe, as he put it, and many more such ideas. And I want to return to something that Paul wrote in that 1985 piece when he said in his Machinations, Haiti was of immeasurable benefit to me, but did I really do anything for Haiti? The question may sound neurotic or defeatist, but I can't help wondering if development projects would be more successful if there were more neurotic anthropologists around to ask such questions. And thanks to Paul, thanks to Haiti, those very questions are now asked routinely. And as we can see in that piece, how Haiti changed Paul and was his muse as we have followed along book by book, seeing how Paul laid the architecture for buildings that would become bakeries, clinics, hospitals, places of higher learning, and an idée fixe that would become a movement. Thank you all.
Will the next panel please come up? Thank you, Anne, Arthur, Loon, and Han. I'd like to introduce the moderator of our next panel, a close friend, Dr. Joya Mukherjee, who's the Associate Professor of Medicine in the Division of Global Health Equity at Brigham and Women's Hospital, and she's an Associate Professor of Global Health and Social Medicine in the Department of Global Health and Social Medicine at HMS. She directs the Masters of Medical Science and Global Health Delivery program, as well as the program in Global Medical Education and Social Change. And she served for the past 23 years as the Chief Medical Officer of Partners in Health. Dr. Mukherjee graduated from the University of Minnesota Medical School, trained in infectious disease, internal medicine, and pediatrics at the Mass General Hospital, and attained an MPH from the Harvard School of Public Health. Joya is an internationally recognized expert on global health delivery and the human rights-based approach to healthcare. She's the author of a widely used textbook, An Introduction to Global Health Delivery, Practice, Equity, and Human Rights, published by Oxford University Press, and currently in its second edition. She is a well-known advocate for the poor and is frequently invited to speak at other universities, and she has received several awards for her teaching, her service, and her scholarship.
Thanks, Joe. And thanks for getting that vowel right in my last name after all these years. No, thank you all so much for being here, and I want to have a special welcome to Jeff and Katie Farmer and Dee Dee Bertrand Farmer. It's so wonderful to have Paul's family with us. We all still speak about Paul in the present tense. It's hard to move beyond that. And I'm with a great panel here to really talk about not only Paul's influence on all of us, but Haiti's influence on the world. And I think we heard so much about how Haiti so influenced Paul. And Paul carried that with him as he taught all of us, as he continued to build and lead a movement that was not only his intellectual fortitude, but the fortitude of Haiti. And my own personal connection to the movement started working, on the AIDS crisis in Africa. And at that time, there was very little treatment. And I was working in HIV prevention in a very plain public health way, teaching children what AIDS was, how it was transmitted, how it could be prevented. And when we asked these children what their risk factor for HIV was, they all said, all 92 schools across Western Uganda, they all said poverty. And I was really broken by that. I was shaken by that. And when I returned to the academic sphere, nobody wanted to hear that. They wanted to hear about behavior. They wanted to think that was a strain of HIV, a clade that was different, that was more aggressive. But they didn't want to hear about young girls who were the heads of families and taking care of their siblings. They didn't want to hear about men who worked for weeks, if not months, in mines and couldn't travel to their home villages. And then somehow I stumbled across AIDS and accusations. And the thing that made me cry was an interview that Paul did with a patient in Haiti. And it was the simple sentence she said that AIDS is not the first thing. AIDS was not the first thing she was worried about. She was worried about her children, about food, about housing. And I went to talk to Paul and signed some kind of blood contract like Loon signed forever until death do us part. And I think it was Paul's scholarship in decolonization, which we call it now. But it was really every book that Paul wrote. And yes, it's anthropology. Yes, it's ethnography. But it was always elevating the voice of the suffering. His books, page after page, are Yabam in Sierra Leone, are Asefi, sorry, Jim, Asefi in Haiti, are always the people who are suffering, who are actually speaking and telling their stories. And we talk so much about that, but those were the seeds that Paul planted in all of us. Listen to the patients, walk with the patients, believe that what they tell you is what is right, not necessarily the halls of academia. Maybe we can take those voices in academia. And I think in this dark, long, long night of grief, many of us have leaned into funny stories of Paul, and so often they have to do with gardening, carrying seeds in our pockets, smuggling saplings or koi into different countries, contraband. And many of us have been victims of horticulture, which I think the farmer children coined, endless quizzes on names of trees and flowers. And as I and many of us are waking up a bit from this terrible grief, we find ourselves in Paul's garden, right here. Because it was the seeds that he planted. That's all of us. It was the seeds that he planted from Haiti to Rwanda, from Rwanda to New York City, and back all the way around to Haiti again, building resilient health systems. We are those human seeds that even Oscar Romero talked about, that we are here to plant the seeds for the next generation to come. And nothing carried that message more for Paul than higher ed. He believed in feeding school children and primary schools, but university education, he thought, was the way to change the world. And that's why he was so deeply committed to Harvard, to the Brigham Women's Hospital, and died at the University of Global Health Equity. And we're so fortunate to have a partnership now between our department in Global Health and Social Medicine and the University of Global Health Equity, because it's in this way that those seedlings will keep going and keep being planted generation after generation. And so this part of the panel is really to talk about that generative nature of Haiti and the lessons that Paul gleaned from Haiti and how they transmitted throughout the world and will continue. So I'm going to start with Dr. Joe Mubaligi, who is the Vice Chancellor of the University of Global Health Equity and newly named the Chief Innovation and Global Growth Officer, something like that. I'm not so good at titles. We also have then Dr. Michelle Morse, who currently serves as the Chief Medical Officer for the City of New York and is a graduate of the Global Health Equity Residency Program that Joe runs and Paul created, along with Howard Hyatt. And Marshall Meese, who is our current executive director of Zami Lasante, and really came to us, grew up through the response to the earthquake and the building of the massive teaching hospital at Mirabelais. So I'm going to start with Joel, because I think one of the first and most important seeds was that one way across the ocean. When we were invited, Paul was invited to bring those lessons from Zami Lasante to Rwanda. And that was for Paul such an exciting moment to see, and by the way, for our Haitian colleagues who understood, our patients said, we have treatment for HIV so that our brothers and sisters in Africa can have that. They said that in 2001. And so to have that privilege, and Joel, you were there from a very early days, as many people, I see Manzi, our first nurse, who's now Dr. Anatoly Manzi, a Deputy Chief Medical Officer. But Joel, why don't you start?
Thank you. Thank you very much, Joya. First of all, I would like to express my gratitude to be on this panel. As we're coming here, I was chatting with Cassia, who gave me a little bit of a story about the symposium. Starting really as a family reunion around Paul, and look how big the family is now. And I couldn't stop by thinking how of a great connector Paul was, bringing all of us with our different background, different places, different experience together as a family. And I had a few things to share, but I think the previous panel disrupted a bit my thinking about what to share, because I think, thinking in terms of knowing the right thing to do and knowing how to do it, it's quite a journey. And Paul got it. And understanding that Haiti and the Haitian people were his teacher in getting it, how to do it. And also the choice of going where things were harder as well. Reposition at that time Rwanda as a country that Paul will definitely feel interested to go and work, a country disrupted by a horrible genocide, a deep social tissue destruction in that place. And in the midst of those ravaging situation, diseases like HIV stepping in and destroying even further the few remaining families and so forth. And Paul being invited to Rwanda and seeing that place really to be a place hard enough to go and do the work, he was probably in a stage where he would understood how to do things from the learning in Haiti, and decided to go in the country with his teachers. And we had people like Ferney and others who actually came in Rwinkwavu among the first teams of doctors from Partners in Health, helping setting up the hospital there, but as well as demonstrating how to provide a care and compassionate service there. So when you hear stories from people, I know Manzi have hundreds of stories like that here, and people like Gatoto back in Kigali, in Rwanda, who were among our first patients, and Peter and others, they tell you the stories of all the Haitian team that we had there with Paul going in a community, carrying patients with their own hands, identifying them in their homes, bringing them in Rwinkwavu Hospital, sleeping on the floor in the same ward as the patients, as construction was going on. And that has been a shocking experience for the new nurses that have been hired, Rwandan there, because they were like, and at that point, there is in Kinyarwanda a name when you call people are foreigners, like umunyamahanga. They were like, if umunyamahanga can do that for our own people, we should do even more. And that's how the knowing the how to do it was being transferred from the Haitian team and Paul and everyone to the rest of the IMB team. And that work really demonstrated what we call now, we have names for it. We call our social medicine or accompaniment and all those stuff. But it really moved quickly into a systemized approach to develop. From the first community health workers that were hired, doing that same work, learning from the team that Paul and you, Joy, and everyone brought here, and Didi, to really, and Didi championed that, to really train the community health workers in Rwanda, and the work that Didi and everyone else that did that there really shaped the model of what is today the community health workers network in Rwanda, currently expanding to close to 60,000 of community health workers across the whole country, doing that same model of practice. That is the impact. The learning from what is the right thing to do to how to do it. And I just want to close a bit on this story is that to understand the impact of it, even beyond the health system is also to understand the impact of it or what is happening right now at the University of Global Health Equity. Only probably 2 months ago, there was this story that came to me of one of our fourth-year medical students who, over a weekend, decided to go into a health center, again, just to observe and see how work is going on there. And arriving there, she found the nurses there discussing about the patients who escaped the facility, escaping in a way like, she was here and she disappeared, and that patient was in labor. So, and then you understand the concept. How can a mother who is in labor, who came to deliver, escape? The hospital was totally a failure of the system, and the student understood that. The interesting thing about the students, she's a student who come from Butaro. She was born and grew up in that community, and she knew the village of where that patient came from. She read on the file, she knew the village, and decided to go to the village. And went to the village, looked for the patient, sat with the patient and her family. The feedback for the patient was that she was mistreated at the health center. Today, my colleague Val mentioned that so powerfully in her talk today, talking about obstetric violence. And the student had to talk with the patient and their family and promised them that she would stay with her until she delivered. And then the patient went back with, this is fourth-year medical students. And this is how, close that to 18 years after Paul, Didi, and all the team that Fernand and others did the work in Gwimwavu, and the lesson is still being transmitted now into a fourth-year medical students who will become the future doctor and global health leaders. Thank you.
Thanks, Joel. That's such a powerful story. And I think one of the amazing things that Haiti taught Paul and all of us was this radical notion of equity. And to do that, we need to break down hierarchies. And that can be very, very hard in medicine. And so, Michelle, you have been so rooted in Haiti since you were resident, spent so much of your time in Haiti, really fell in love with Haiti, as so many of us did. And now you're in a really different position in the United States. How do you see Haiti and Paul's teaching, of course, sort of seeding your own practice and your work?
Thank you for that, Joya, and thank you for that, Joelle. There's a lot to say in response to that question, and I feel like the first panel just really opened up the floodgates of stories about Paul and Haiti and how his life and the history of Haiti have influenced all of us. And there's so much to say, but I'll try to be somewhat concise. But it's just beautiful to be here with all of you as well. And as I was trying to figure out how to make it to Boston, I was feeling so strongly that this community of practice, this community period, is so much a part of the reason why I'm able to, do the work that we do in New York City and do so many other things. And I'm so thankful to all of you. And Paul brought us all together. But I want to share just 3 reflections on how my experiences learning in Haiti from Paul and so many of you have influenced the work we're trying to do in New York City right now. In so many ways, New York City is a representation of the world and is its own nation state in so many ways, 130 plus languages, 8.5 million people, and all the complexity that comes with it. But frankly, there's not a piece of work that we're doing in New York City that to me doesn't somehow relate to the experiences I had in Haiti. And I've heard Paul say it many times, that I've heard Paul say, I owe Haiti so much. And that is exactly how I feel. The first thing that comes to mind, of course, there's many stories, but the first is the first time that I went to Haiti. August 2009. Howard Hyatt was there, Joy was there, Joe was there. It was my first time to really step foot in the country, despite having read lots about it. And on the plane, I read the uses of Haiti. I read it in kind of the days leading up and on the plane, and then got to see in so many ways what was in the book come alive. And it is so much why I became so engaged in the work in Haiti, was seeing the teams going on home visits, working with community health workers, walking for 4 hours to do mobile clinic. That was work that was working and having impact. And there had been so many experiences I had trying to work and engage in very difficult places, in places where people were generationally marginalized, oppressed, and the health outcomes that all came with that. And things weren't working. And this was a model that was working. But in that context, part of what I also learned, of course, in the uses of Haiti was about the $21 billion that France owed Haiti. And to be able to practice and take care of patients and be on home visits and actually see that work up close and know that behind the scenes, the part of the conditions that created that whole context was that theft and extraction and the world punishing Haiti for hundreds of years after becoming the world's first Black republic, first successful revolt of enslaved people. Knowing that context while taking care of patients was beyond profound for me, and really gets to that point of theory and practice that was discussed earlier, but was so important for me. The second thing that comes to mind for me, the connection to New York City, is that we are doing some work right now looking at the racial wealth gap and how the racial wealth gap impacts health outcomes. And many of you, of course, are aware we look at income and health all the time. We don't look enough at wealth. And so that analysis from Haiti straight to New York City and to so many other places is so critical. And part of the reason we started exploring that is many of you are aware of the Lancet Commission that Paul was involved in on reparations, as being a part of the foundation for that. The second is even more tangible and maybe follows along a little bit with what Joelle was mentioning, which is the Conge Declaration. And I had the pleasure of getting to read the Conge Declaration when we were first starting work at Mirabelais Hospital, and we were trying to figure out, what are the really tangible examples?
Michelle, mention quickly what the Conge
Declaration. I will. Yeah, exactly. We wanted these very tangible examples of what it means to practice social medicine and what it means to be in proximity. And the Conge Declaration, which is a declaration developed by Haitians in rural Haiti, in Conge specifically, in 2001, that really describes what their demands were and what they knew their rights were around not just access to HIV treatment, but access to food and housing and all of these other things that they knew they didn't have access to for any failing of their own, but for the history of extraction and inequity and economic inequity. And it was a declaration that when you read it, you can't not get goosebumps and feel the experiences and the spirit behind it. And it became one of the tools that we used for teaching the medical residents at Mirabelais Hospital about social medicine, students from all around the world, as a part of the organization I co-founded, Equal Health, in our social medicine courses. And then the tie to New York City. During the pandemic, we developed a community health worker-led program called the Public Health Corps. And in fact, in the early days of that program, the Conge Declaration was one of the tools that we used to show what the proximity and what the real work of community health workers can look like. And then I think the final thing that I'll just say in terms of the ways in which my experiences learning in Haiti and learning from Paul have influenced me in New York City is acknowledging that sometimes a massive, massive challenge can feel so big that the most important thing for you to do is really find what the small step forward or what the small win is, and that nothing, in fact, is too small. And I'll just say the weight of the pandemic in New York City, the weight of the inequities across the entire world during the pandemic were all things that were very heavy and very, very hard to bear. and very, very difficult for people like ourselves who consider ourselves to be, passionate about health equity, passionate about changing the world. There were many times where it felt like we couldn't do it. And I think trying to refocus ourselves on what those small steps forward and small wins were is something I certainly got to practice and learn from Haiti as well as from Paul, and something that keeps me somewhat hopeful to this day about our work in New York City.
Thank you. Thank you, Michelle. That's so beautiful, and I think, seeing that all of this work from Haiti can influence here in the U.S. as well, and we saw that especially during COVID, but continue to see it, and we're grateful for your work as Chief Medical Officer of the City of New York. So Mark, what can Haiti tell us about Haiti? What has informed Haiti about Haiti? I mean, you are Haitian American, and you've been leading Partners in Health's biggest enterprise, an independent organization, Zami Lasante, and you're learning about Zami Lasante as you're in this job, and taking tools that have existed from the Haitian people themselves, from the people in Conj, and then applying them to higher ed, to a giant teaching hospital. And so how do you think about the kind of continuing innovation? I mean, Jim once called Haiti the crucible of creativity. How do you see that the historic work of Haiti and the history of Haiti informs your work today and the work at Zami Lasante?
That was an easy question.
Sorry.
If I could go back a little bit more, and I would say what informs us is that we keep learning, and we never stop learning. I feel so fortunate just to be here because I sit at the feet of those that started it, and you're constantly talking about the social justice, the equity, the care. We're hearing about this. I've learned so much from my co-panelists here. And the beautiful part of it is, I keep going back to this word in my head, is legacy. What we're learning is we're part of the legacy, and the legacy continues. We continue to be those that are teaching and learning at the same time. We never get to the point where you know it all. The fortunate part of being, and I think the blessing of being at Mirbalais Hospital is, I had, what do you call the cloud of witnesses? I had, yes, Paul there, but we also had Macleys, we had Milliens, we had Maxis, and they're constantly teaching at every opportunity. And they constantly get upset at the injustices that we see. Why are we having this treatment of this mother? Why are we not getting, so it's this righteous indignation in this point, and that feeds then, and it holds you accountable, because the why becomes personal. I keep these two words, is legacy and personal. You're gonna keep hearing it from me, because the why becomes personal. And it's like, not just why are they not getting the care that they need at this time, but what are you gonna do about it? And it's like, no, what are you, not like, what are you, like, what are you gonna do about it? And you're like, okay, but that gets ingrained in us to the point where you're speaking to others. So what is going on? And what are you going to do about it? Like, and that's the part of it. And I think it's not just what Haiti can learn, it's what Haiti continues to learn, what we continue to learn from those that are there, what they continue to learn from the students that come in new with those fresh perspectives, with going after those patients. I think I can go back to, and even to the point where now you're seeing this generation and next generation going forth, of residents, of nurses, of biomed, of facilities, and people asking, now this is our patient, so if they can't get, when we had an issue, and I have to go back, you guys all know there's a lot of issues going on in Haiti, but the main thing that you don't know is how people are fighting to keep the work going. And I wish you could walk in the shoes of our team. Because the why is, yes, the patient gets to the hospital, not just to the hospital or the facility or whatever it is. We're not going to have power, sorry, energy, fuel, but then you'll see, and you don't see the biomed, or you don't see the facilities person just as involved because they can't let this happen or something happens to this patient. So when you start talking, when we're talking about patient care, it's not just for the clinicians, it's for our non-clinicians that are hearing it too, and now have been, for a best word, indoctrinated in. And it's become our patient. It's become personal. If that light goes off, it's personal to me. And if you see something happen, you see the whole team start mobilizing. If anything happens, you start seeing, and the WhatsApp group, you're hearing it and you're constantly on it and you're hearing going back, hey, does anybody have this? I have this, come get this. We're going to get this. We're this patient, somebody's here. And you're having that constant, it's about our patient that we're working together. Even more so, and I'm going to go back to what we're learning and continue to learn is, I do remember several times when Paul comes down and he's in the patient ward. And it's the teaching, but it's also the caring. And it's the modeled of caring. It's the, let me sit here for a while with you, regardless of whatever's going on, to the point where those patients know him intimately, right? The people know him as a friend, not just as my clinician or my doctor and so forth. To the point where even now, if you're saying, and I go back to when we came back from the last earthquake, right? And a woman lost her phone during that earthquake. And the question was simply somebody find her a phone. Even though we had transported her grandson all over to the facility, it came that personal. So if you're going to go to those micro details, and we keep teaching that micro details, because that phone means, can she get in contact with somebody? Do they know that she's alive? Do they know that that child is alive? It's even more beyond those little things. Even though, did somebody get her food? Because we're feeding that child, but we're not feeding the parent. You're not thinking about, but if we think about as a holistic care, not just the one in front of me, not just, and if that mama come, where is she gonna sleep? Is she's gonna sleep on the floor? And that, I have to keep going on, and then if one thing that Haitians can learn from Haitians from the time, those before us, is keep talking about, to those that's coming after us, about the heart of it, about the person, making it personal, about going to that community, about, and if I could go one time, when I first started at HUM, and a lot of my experiences at HUM when I came there in 2013, L'Hôpital Universitaire Hospital. Yeah. And learning about the full system. I do remember one thing that Paul said to me, and he said, don't be an office person. Yes. And it's that sort of like that looking into you, trying to get you to get it. Like, and it's like, don't be an office person. And that stayed in my head. Like, don't be an office person. The next gem that stayed, and if that's one thing that I teach to my team, or make sure, like, don't stay in the office. You better walk a mile in somebody's shoes. You better get your sneakers on and start running. No. Oh, no, these shoes. Oh, my team, though, like, in the hospital, you know, I'm usually in my sneakers and stuff, and I leave the shoes on just in case we get a visit or something, and I throw things on. But usually it's getting ready to go and do whatever you need to do, jump into it. So if we share, and if you see that within the team. Second thing that I would say that I learned, and I believe Paul continued to share with others, is ask the why, and don't let that be your obstacle. Don't let I don't think we can, or this is too hard. Then what are you going to do about it? What's that next step? How are you going to get about, and I still remember that one time when we had the twin separation, and he was like, I was like, you know, we need, you know, putting all these excuses. He's like, basically saying, like, don't give excuses, tell me what you need. Let's get to that next level. So if there's an issue, what are you going to do about it? And so if you hear that, and I have to say, you hear that in what Loon says, whatever it takes, that comes down to, what are you going to do about it, right? You hear that in what Dr. Maxey, when he gets really incensed about the treatment of women. It's like, and he calls a whole team together, what are you going to do about it? You know, so that's the one thing I think we keep learning, and if we keep teaching our residents and our team new members that are coming up, and keep that same spirit, I think Haitians will continue learning from Haitians and teaching others about that spirit of what are you, it's about your responsibility, not somebody else's.
Yeah, thank you for that, Mark. That's beautiful. I mean, I think, there are a couple of Haitian proverbs or sayings or thoughts that I'm going to ask each of you to reflect on. So one is, Yon seul doit pas qu'à manger kalalou, which means you can't eat gumbo with one finger. And I'm going to pose that to you, Dr. Mubiligi. Like, tell me how that idea of who you need at the table, how many helpers, how do we work together to eat that gumbo?
Thank you. I think there is probably something similar in Kinyarwanda, where I talk about.
I don't speak Kinyarwanda. Yet.
Biryo habisangiwe. The food does not taste good by itself. It tastes good when it's shared, and everyone's sitting on the same table, and having that same meal. And I think part of the lesson that Paul had in Haiti and learned from the Haitian, and that brought back to the work of understanding that this challenging task, which is basically, swimming against a stream but get the right thing done, requires a village, requires a different skills and different people, and really coming. I think in other words, call it partnership, and that's where the name Partners in Health comes in, and that's the only way, because the challenge is big enough that you definitely need these hands to come together. Our hands in Partners in Health, these hands to come together. It's like those hands coming on the same plate. Eating that food, and I think that was the thing that was brought back. I think even in the culture that was created in Partners in Health in Rwanda, where as a team, you being a driver, being a community health worker, being a nurse, there's not that layers of hierarchy, and that everyone is playing a crucial role in that work that you are doing. And that is seen, when you go to pick a patient in a village, the driver helps you, puts their hands together. It's not only sitting behind the wheel. They're part of that team doing that work, coming together. And you talked about the biomedical. We've been talking this morning about, sometimes you can decide to use an equipment there. I had a personal experience that will never leave me, I'll put it that way, where a pregnant woman doing eclampsia, but you are using a cuff to test blood pressure, but the cuff is not working. The cuff is giving you the wrong information, but who tests that monitor? Who adjusts that to make sure that it is working and it's functional? What is a normal blood pressure and what is an abnormal blood pressure, but the tool that should give you that information is not functioning. And the patient died. Just because, and we realized later that it was actually, eclampsia going on, and the monitor, the cuff that was using, was obsolete, was not working. So that is, I think, that say in terms of, that's a whole team that you need, those hands coming together, and that can extrapolate that even beyond the team doing the work on the field, but even the people around the globe who believe in that work and brings in resources to support the work. They're also part of that hand coming together to have that meal. So that will be my reflection.
That's so great. Thank you. And I do think that's a revolutionary idea that comes from Haiti. The sort of horizontal nature of our work and really working together. So Michelle, I'm going to ask you this one. Why would you say you're petite Desseline Louie?
Oh my God, I love it. Thank you for that. Thank you. No, it's, in fact. Yes, okay. So Dessalines being the person who really took the Haitian Revolution to its full completion and change, being the deputy of Toussaint, being also someone who believed very deeply that revolution was the only path forward out of slavery for enslaved people in Haiti, and also believing that we couldn't make friends of colonizers. And I have to say, it's a hard-won lesson, and also the one that led Haiti to being the first ever successful revolt of enslaved people and the first ever Black Republic. And that's a hard conversation to have when there's a lot of discussion right now about violence and the uses of violence. And certainly we could get into that conversation if people want to, but I also want to pick up, actually, to keep going with the Petit Dessalines theme on what Joel was saying. He was talking about a blood pressure cuff not working, and it reminded me so deeply of the experience during cholera in Haiti. And is another great example of having a structural analysis and knowing the importance of being able to demand radical change, revolutionary change, in fact, including the end of MINUSTA, actually, which was the UN force that was occupying / supporting Haiti. And the reason it comes to a blood pressure cuff, which doesn't sound like it should be connected to Petit Dessalines, is because, in fact, many of us were first responders during the cholera epidemic. And I will never forget me and Dr. Merle Robert, who is an internist to this day at Mirbelet Hospital, going to Saint-Marc. Patrick, you know this story, and maybe a few nights into the beginnings of what became the cholera epidemic, we were doing the night shift, and we were taking the blood pressure of patients all over the hospital. There had to be maybe 300 patients for a hospital that usually had 150 or so beds. And we thought our blood pressure cuff was broken. And in fact, it wasn't broken. But for those of you who are clinicians, you know that the symptoms of cholera are essentially cardiovascular collapse. You become so dehydrated that you don't have a blood pressure. You're so hypovolemic. Your body is so dehydrated. And every patient whose blood pressure we took, we thought something's wrong with this blood pressure cuff. We can't get a blood pressure. And they were all in hypovolemic shock from cholera. And, eventually it became clear that it was cholera. Eventually it became clear that the blood pressure cuff was in fact working. And we spent that whole night, putting in IVs, giving people oral rehydration solution. And then it didn't stop there, because months later it was, okay, so then how does this experience translate into demanding justice at the UN for the reason that whole entire cholera epidemic started, right? And that's the Petit Dessalines part.
Yeah, absolutely, revolutionary. Thank you, thank you. So Mark, last question for you as our executive director of Zami Lasante, a role handed down to you from Luneville and Paul himself and Pierre Lafontaine, and I've heard you say this to your team, and it was mentioned in the first panel. So tell us what Équipe Solide means.
Oh my God, easy one. Yeah. And if I could tell one funny thing, so Paul would ride me on my Creole, because I have a heavy English accent, so he's like, "Upaka pali Creole." I was like, "Yes, I can." So he was like, "You've been here for how long and you still can't speak it?" I was like, "Look, but you understand me, right?" But Équipe Solide. I'm trying to find the best way to tell you without breaking up. Again, if I could take you and transport you to meet our team, I wouldn't have to explain. Because it comes down to this: we are a family. Équipe Solide means that we are working together, we are communicating together, we have each other's back. Not just there for the patients, but for each other. What you have now, Équipe Solide, and you mentioned it, from the T-Bens, when you have the drivers, our drivers, sorry. I'm saying the names like you know them. Do you know them? Like, I'm gonna tell you their names.
You know T-Ben.
You know T-Ben, like the drivers, and that's there 24/7. When we had the COVID outbreak, was one of the first ones out there, not knowing what's going on, and is going to transport patients, doing everything that outside of what the driver's doing too, helping with moving bodies, helping us, preparing. Like the Josettes, which you don't know who has the heart of gold. When she sees somebody, it's a quiet presence. It's right there, picking up the patients, calling them, giving them her own money to get them food, finding something out that. Or like, that's the Equipe Solide. Or like I could go on and name the different people in our teams. I'm gonna call like the Fabrice, which at everything, when we had the issue with the fuel last year, his team went every day to the port, regardless of gunshots, regardless of what was happening, going to get that, going to try to see if they get the fuel for the sites. Like our pharmacy team, and there's much too many of them saying, trying to figure out how do we move from one site to another to get things to our pharmacy and our facilities so that they can get there and at their own peril, at their own risk. That's what I'm saying. It's not the thought of, oh, I'm not gonna do this, I'm off duty. No, it's about, hey, if my team member is going to be in this fight, I'm going to be in that fight with them. And that Equipe Solide, it becomes this 360 team, from the administrator to the cooks, to the drivers, to the nurses' aides, to the physicians, to the surgeons, to the community health workers, to the patients themselves, who that we end up involving too. So when I wish, and I feel this is an underrepresentation, but I wish, and I'm going to throw this out to maybe the communications team, if we could do a virtual follow-up with our team, and you could get to see them, I wouldn't have to explain to you what Equipe Solide means.
Great, beautiful, beautiful. Thank you, Mark. So as a bit of a wild card, I did my best. No, we have these wonderful panelists, and I think you can all see that, Haiti and Paul, for us, are intertwined. And the lessons that we learn from Paul are the lessons Paul will learn from Haiti. And, I think for all of us, there is a deep love of the spirit of the Haitian people that is like constantly pulsing through our scholarship at Harvard, our work in the city of New York, in Rwanda, back in Haiti, and all over the world. And so, we really thank Paul and thank the history and the persistent, struggle of the Haitian people as really something that is so important to this work. And we look forward to a day when we can have this symposium in Haiti. Thank you all very much.
Thank you, everyone. We'll be back at 3:30.
to thank. Oh yeah, there's a long list. I'm sure. I'm sure. That would be lovely. Yes.
The second half of our program will begin in 5 minutes. Hello, everyone. Please return to your seats, and we'll begin with the second half of the program in 1 minute. Please take your seats.
Mom mode.
I am a mom. I can take out the mom.
Put your butts in the seats.
Nobody wants to hear that.
Not your shit today.
So once everybody's settled and quiet, I'm going to hit the light. Please take your seats. We'll be showing a movie shortly.
Will be a problem. Basically, if people, if diseases are restricted to poor populations, you can bet that the amount of money invested in research and treatment options is going to be very slim, very small amounts of money. So, sure, they are bankrupt.
The whole history of PIH really started with poor farmers in the late 80s, willing to do something for the people, especially in the poorest communities in the country, showing that if you have compassion for people, you will do whatever it takes to save lives.
Paul was a visionary and the one who could see what was ahead of us, and Loon Bio was the ultimate implementer who would ensure that what Paul saw could become a reality.
The vision is to build local capacity to provide access to care. When I started recruiting the junior people, we took time to accompany them, to mentor them, to coach them, to be on their journey. You start seeing local people take over to continue the same vision and mission with the passion of helping the most vulnerable.
Social, political, and economic forces like food, housing, medical care are much more important to whether someone lives or dies than any microbe or genetic condition. And that's why we are fanatically devoted to looking at social and economic rights as central to the treatment of disease. That's really been one of the core principles that comes from Haiti and comes from Paul's works.
I said, now that she's going to start work again, please don't miss a single dose. And she said, I never have, and I believe her. Is it okay to write bravo in the medical chart? Voila.
It is the first black nation in the world and has really set examples for the whole world in terms of human freedom. The PIH movement started in Haiti to free people from disease. The same movement has spread from Haiti to Africa, to America, to all the countries where Partners in Health work.
Every site was started by people who were either trained in Haiti, learned from people who worked in Haiti, and the heart and the soul of bringing the best medical care to the people who need it most has been infused throughout Partners in Health because of what we learned at Zami Lasante.
Moving from Haiti, it wasn't different from what I see in Sierra Leone, from Malawi or Lesotho, because by addressing the need for one patient, we are addressing the need of that community.
It is a very practical approach to equity that we learned in Haiti by talking to patients, by living in community. And it's that same approach that we are using in educating the next generation of health professionals around the world. Paul used to refer to students as his retirement plan. He never thought he was doing this work alone. That's why these investments like the University of Global Health Equity, which will be reaching across the world from Rwanda to Haiti and beyond, is so critical in maintaining the legacy of this work.
We want to repair this world. The way to do it is to invest in the new generation, to make sure equity wherever we are is the norm.
Our team, every day, makes a preferential option for the poor. That is the ethos of Zami Lasante. That is the ethos of Partners in Health. And it really emanates from the DNA of Haiti itself.
So she said, "Msatim jum." You know what that means? I feel great.
Good afternoon. My name is Sheila Davis, and I'm the CEO of Partners in Health. And I have to make a note that those 4 people sitting in Cambridge are now 18,000 around 11 countries. So we certainly did our job well. I'm very honored and so privileged to introduce our keynote speaker today. Michelle Pierre Louie. Her keynote address will be Haiti's ability to inspire. Michelle was the Prime Minister and the Minister of Justice and Public Security in Haiti from 2008 to November 2009. Her appointment included many dedicated roles in advocacy for education, access to information, and culture. In 1995, she became the executive director of Knowledge and Freedom Foundation, or FOCAL, and the first grant that ZL ever received for HIV and AIDS came from FOCAL in the early 2000s. Upon leaving her office in 2009, she returned to FOCAL as the president, coordinating post-earthquake response and projects, and she's been selected for numerous roles at the UN over many years. She is a graduate of Queens College in New York, holds honorary doctorates from St. Michael's College and the University of San Francisco, and was previously resident fellow at the Institute of Politics at the Harvard Kennedy School. She's also professor at the University of Keynote in Haiti. Michelle.
Thank you, Dr. Davis, for these kind introductory words. Honor. Honor. That's the way Haitians salute themselves, especially in the rural areas of Haiti. I first want to thank Dr. Vikram Patel, Dr. Ratigan, Dr. Ivers, Dr. Sheila Davis. I was so impressed because my letter of invitation was signed by those 4 prestigious doctors. But I also want to thank Louie, because Louie is the first one who talked to me about the symposium and invited me. But at the time, I didn't know I was going to be keynote speaker. And I want to salute Didi and Paul's brother that I met for the first time. I'm very honored to be here, really. I was asked to talk about Haiti's ability to inspire in the world at large today. But I would like to start by telling you about Paul also. A lot has been said, but I will give you my own perspective. How Paul inspired us, how Haiti inspired Paul. In 1995, I was a member of a committee that was in charge of organizing an international conference on democratic transitions. It was a significant moment for Haiti, and we wanted this to be a major event. We had scholars, intellectuals, activists from all over the world. And of course, the young Dr. Paul Farmer was invited. That was the first time I met him and listened to him. He concluded his remarks after we had a big standing ovation, by saying this, and I quote, "We doctors sometimes have the good fortune to cure patients, to alleviate their sufferings, but our medical knowledge alone does not give us the means to explain where this suffering comes from and how it spreads. Doctors, social workers, psychologists, and anthropologists can prepare and publish their case studies, but they won't get to the heart of human suffering until they go beyond the level of individual experience and place each case in its historical, economic, and political context. Go to the heart of human suffering." The next year, in 1996, Paul came to see me with Louie at FOCAL, Fondation Connaissance et Liberté, the institution I had created the year before. Paulo spoke at length about his new endeavor. He wanted to launch the HIV Equity Project, and he had a lot of questions. Quote, "Why should the poor not get the best medical treatment possible? If there is a cure for a terrible disease, they should be able to have access to it. And we doctors should be able to save their lives. The poor are dying for lack of human care." I could see from his analysis that he wanted to get to the heart of human suffering. We gave him the grant. It was the biggest grant from our new foundation. Paulo always said that our grant opened doors to leveraging much larger financial aid for Zami Lasante. Since then, Paulo and I met on many occasions in Haiti, where he invited me to speak at the forum he organized every 2 years in Cange, but also abroad, wherever we were called upon to express our common passion for Haiti. For the rest of his life, in Haiti, in Peru, in Rwanda, in Malawi, in Lesotho, Paul would question the root causes of systemic poverty, taking an interest in people's lives, collecting data that would enable him to better understand the issues facing the poor and suffering communities. Suffering was everywhere. In the territories he worked in, creating a geography of fear and misfortune. But it all started in Haiti. Paul noted the main causes of death among the disenfranchised population of Cange: malnutrition, diarrhea, pneumonia, malaria, typhoid, cases of neonatal tetanus and meningitis, and complications during childbirth, all aggravated by malnutrition. This precarious living condition can only be the consequences of total denial of recognition and to the right to dignity. He grasped the close ties that bind kinship, land, body, and gods in Haiti, and the loss of meaning when these ties disintegrate. He also gauged the marginalization they suffer at the hands of dictatorships and their local and foreign allies. Thus, an interpretative anthropology of suffering, sensitive to the local and individual consequences of history and its relation to economic and symbolic power, can provide new readings of cultural attitudes elaborated in the face of disease, fear, pain, hunger, and brutality. This interpretative anthropology of suffering draws on ethnographic, historical, epidemiological, political, and economic analysis. Haiti's history is intimately linked to successive forms of globalization. Paul Farmer has written dozens of books and articles in which he shares his philosophy and vision of the world. And as was said earlier, his legacy is immense. His protean experience, which he translated into a system of thought that in turn fed his lines of action, provide us with keys to understanding the systemic and structural aspect of poverty and inequality. This insight informs us about the links between an imaginary world dominated by anti-Black, even anti-Haitian racism, and an ideological construct that sees any gesture, behavior, or speech by this other, real or imagined, as signs of aggression deserving to be repressed. More reason to make him or her a victim and accuse the victim. In the preface of his first book that was mentioned earlier, AIDS and Accusation, in the French version, François Héritier made a very straightforward statement in that sense, and I quote, "The moral discrimination at the heart of the global judgment of Haitians in the United States leads to blaming the victim and placing the burden of accusation on themselves in a double motivation, infected because exotic, and exotic because infected. We are therefore dealing with what might be called a process of exoticization, which refers to a guilty strangeness of Haiti, expressed with force at the time of the appearance of the HIV head. What is the basis of this imaginary, which for centuries has constructed representations of Haiti and of its people as superstitious, inept, and incapable of welcoming the benefits of civilization? And this is exactly what we are fighting against. Like all of us here, I learned so much from Polo, from his writing, from our conversations, from the exceptional person that he was. And I know we shared a common vision and a set of values. We were once invited together at a conference at Harvard University, and he called me an organic intellectual. I had never thought of myself as an organic intellectual, but that was Polo. But I tried to understand what he meant in a Gramscian sense. And he meant, and he told me later, the role one plays as a social actor in being able to connect with empathy and care to the most marginalized communities, to salute and uphold their journey, their tremendously hard work, and their sense of pride and dignity, despite all ideological entanglements. This requires knowledge of our own history and of the way it is embedded in the world history. Haiti is in the world. Next Sunday on November 18, we're going to commemorate the unique victory in modern world history of former slaves against Napoleon's army. 220 years ago, an incredible and heroic victory should have had great significance as it exemplified our undeniable claim to humankind by thwarting colonialism, racism, and by rejecting slavery. This only should have been a source of inspiration for all those who were oppressed and understood the real meaning of a free, independent Black republic. A few did. The problem is that we were Black, and we still are. And that was irreconcilable with the spirit of those times, despite a persistent paradox. Countries like France, Great Britain, that invented the Enlightenment, les Lumières, the Aufklärung, that is the concept of, who invented the concept of liberty, of tolerance, of human equality, the role of reasoning, la raison. So many of the philosophers, the thinkers, whose work we still study, had shares in the slave trade and found themselves in inextricable dilemmas as to accepting that blacks are people just like them. And as it is being said today, that Black lives matter. Our revolution and independence are still inspiring events to those who accept to delve into their true historical and symbolic meanings. At the time of the slave insurrection in 1791, close to 70% of the captives had just been bought and deported to the colony as slaves. In 1793, the General Proclamation of Liberty, of freedom, by a representative of the French Revolution, made them free, and by so doing, acknowledged their belonging to humankind. When Napoleon chose to reestablish slavery and send the troops, they were the first to rebel and fight against the French army. They knew that they had reached the level of belonging to humankind. It's only after that the black officers rallied. What is so inspiring is to find out how captives coming from different parts of Africa, different ethnic groups, speaking different languages, established themselves in this new land and invented a new way of life, creating the new Haitian peasantry. The captives who were enslaved on the plantation system and deprived of all rights had their own concept of freedom. At the birth of an independent Haiti, they became the Haitian peasants and went on to create a mode of life in accordance with the freedom they had just imagined. First, a confraternity among those who suffered, une confraternité de la souffrance, to recognize one another and to live together with a common understanding of dignity, honor, and respect. Second, an express need to be protected by the state against all assault on their new status, which they hardly ever get. Third, a sense that freedom meant never having to work for others ever again on their own land, for nothing or very little in return. The rural communities imagine a new political order capable of offering them the space needed to reconstruct their lives as the communities who had suffered and would never again suffer the racism, the terror, and the constant violence of the plantation system. They wanted to build their own identity in their struggle for equality. And they did for centuries and are still doing it. The struggle continues today. And I'm not going to talk about what happened when France forces us with the ransom. And we had to pay 150 million gold francs for recognitions of an independent Black republic. And to pay the first annuity, which was 30 million, we had to borrow in France. And this is what historians in Haiti call the double debt. And we got involved in the spiral of debts until today. When the Americans occupied Haiti in 1915, they said, all right, you don't owe any France, you don't know any German, you're going to owe to us now. And they collected all the debts. And it took us years until today to pay our debts. We're still in the spiral of debts. The struggle continues today as the situation in Haiti remains very difficult and very complex, as you know. Difficult because on a personal level, you realize every day how life is fragile. Your own, your families, your colleagues, your partners. High insecurity has impacted our mode of functioning. Daily life is disrupted by gang warfare, kidnappings, gang checkpoints, ransoming and shooting at random, paralyzing circulation of produce and people. You're never too sure that you will make it through the day. And this form of stress becomes a constitutive element of your behavior daily. But it is also complex because of the deterioration of the situation. That is a long process of mismanagement by all the major stakeholders, national and international, and an attitude of neglect towards structural mutations occurring in our country. Since the 1990s, Haiti has received 7 UN missions and been submitted to other international interventions that have weakened the capacity of the state to exert its regular functions. They organize and fund elections, they reform the justice system, they train the police through disconnected short-term sessions, they propose the implementation of laws, they overlook the fiscal system, education, health, and other sectors. This occurred over a 30-year time span that followed a 30-year long dictatorship propped up by international. Since the mid-1980s, the population has doubled, and the bracket 15 to 45 years of age now represents 65% of the population to whom very little is offered. Education, that should have been the main focus. I teach at the university, I can tell you, there's so much to be done for youth and children that have an appetite to learn, but in school are learning so little. That is why we are facing waves of mass migration, the most spectacular one unfolding right now. And this in the face of a state that already suffered from historical weaknesses and has become more and more powerless, inept, and in a way corrupt. At the same time, international crime has penetrated all lucrative circuits within the government and among other businesses. The situation worsens since the assassination of the president. Difficult, indeed. But we all know that hope is a discipline and a commitment. We Haitians, just like all the people whose ancestors were captured in Africa and for 4 centuries enslaved on the other side of the Atlantic, through the most horrific forced migration of all times, we are the Afro-descendants, the first African diaspora. But there is also a new diaspora, a much more recent diaspora, formed by men and women from Haiti, but also from other Caribbean countries who were forced to leave their place of birth and establish themselves on other shores, supposedly more secured. Those who went into exile to escape political persecution, those whose living conditions were precarious enough to take the risk to embark on dangerous boat trips, those who went to study abroad and stayed. Their primary destination remains the United States, but they also migrate to Canada, France, Brazil, Chile, and other Caribbean countries, generally forming a labor force much needed by all those countries. But there are also many cases of incredible success through hard work, education, community involvement, solidarity. Against all odds, quite a few of our diaspora have acceded to high spheres of accomplishments. In academia, I was very pleased to meet with Harvard President, Dr. Claudine Gay, just like I was a few months ago to meet with Dr. Renaud Verret, the president of Xavier University in Louisiana. There is also Reginald Desroches, president of Rice University, and so many others. They are in scientific fields, culture, literature. Everybody knows Edwidge Danticat, Daniela Ferrier, James Noel, Mackenzie Orsel, but also in Haiti. Amazing, in a country where there is still a high rate of illiteracy, how many of our writers are being nominated for the highest prizes. This gives us pride, and it is also a source of inspiration. I could speak of all the doctors, n'est-ce pas, mon cher ami, who are doing such great jobs abroad, but with their mind and their intelligence still in Haiti. That is also why Haiti cannot be reduced to bad governance, corruption, disregard of human and women's rights. All this is true, but we refuse the label, the poorest country of the hemisphere. No, it is true, but Haiti is much more than all this. It is a people that is resisting daily to uphold its dignity, a people that is creative, rich in wisdom and culture, a people that aspired to a better life there in Haiti, but a people that is confronted with the effects of what I just described, but who chose to organize and fight to be free, to make a living, to send kids to school, and at the same time, keep an incredible sense of humor. And I think Polo contributed to that sense of humor. At Focal, I work with smallholder farmer communities, from Jean Rabel, Wanamé, Gros-Monde, Verret, Belader, Ansapit, Jacques Melbénet, Nipaquin, Saint-Louis du Sud, Cavaillon, Campérin, Jérémy, Chardonnière. Women and men are working every day to fight against food insecurity, to protect the environment, manage their loan and savings association, les mutuelles de solidarité, mostly run by women, and in spite of adverse conditions, keep hoping for better days. Whenever possible, I go myself to visit, like I did recently in Jérémy, Aquin, Campérin, Cavaillon, Baradère. We are building community centers for organizations so that they can run themselves and decide what to do, and hope we can raise more funding to do the same for other communities. Real sustained investment is very rare. Instead, we are offered scarce, short-term funding based on increasingly bureaucratic conditionalities that cannot be easily met. Haiti is considered a humanitarian case. The humanitarian traps leads and maintains the poverty trap. That is why the holistic approach of the global health equity movement is so vital to our communities. In the way practice, study, and research are intertwined in providing care, improving health, and achieving equity for all. Polo's experience on the ground as a witness to income and social inequality, lack of education and employment, malnutrition, and so many other factors that affect our marginalized population's life could only lead to a global vision of health and equity. Healthcare providers, just like was said in the panel earlier, need to interact, and they do, with communities to address collectively issues of healthy food production, eating habits, prevention and curative care, mental health in harmony with culture for the well-being of the people in Haiti. That is possible. And this stands also for our communities of artists. Like the smallholder farmers, they get very little support, but continue to create incredible works of art. I'm also board chair of the Le Centre d'Art, the most important institution created in 1944 to promote Haitian art and artists. Artists and artisans at Noailles, Bel Air, Rivière-Froide, Carrefour-Feuille have all suffered from the insecurity. But you should see how they maintain their resistance and continue to create in hope to be joined by others. Communities of smallholder farmers striving for a better, healthy life in honor and dignity. Communities of artists and artisans that continue to create the most incredible works of art. Women working miles to sell agricultural produce with a sense of solidarity. Children and youth expressing daily an appetite for learning. This is what I find so inspiring in Haiti, and that is what I want to convey to you and to the world tonight. Thank you. Thank you very much. Thank you. Thank you very much. And if I may add something that just popped to my mind when Loon said that Haiti has not recognized Polo enough. Loon, we should advocate for a posthumous hommage au Dr. Paul Farmer en Haïti. Thank you.
Thank you so much for those amazing, inspiring, and beautiful and harsh in a real way words for all of us to hear. I was thinking so many times Paul would love what you were saying and the motivation that it brings certainly to all of us. And I know that we certainly as an organization and as a community have committed to Haiti long-term and will continue to do that, and thank you so much for your leadership. When I was, thinking about today and all that we've heard, the Tout Moon See Moon or every person as a person is something that obviously is heard throughout when any of us first joined Partners in Health. And I remember when we first went into West Africa after Ebola, when Paul said, "Where are the Haitians? You have to get the Haitians here." And so we did. We had Patrick, we had Maxa, we had Kate Oswald, who grew up under Loon's mentorship, who went to help us start those efforts in Sierra Leone and brought the heart of Haiti to our work there and continues today under amazing leadership. We were at a really pivotal time with Partners in Health, certainly with the loss of Paul, and so many people would say, what are you going to do without Paul? And I think Joya said it so beautifully that we're all in Paul's garden, and he set us up well in all that he's exists in pieces of all of us. The most important thing that I think Paul stood for was it wasn't just PIH, it was also the critical part of partnerships. And the partnership with a big P, we have so many weird things at PIH that you have to learn when you join a partnership with a big P, and it probably took me 6 months to learn what that was. But the partnership with the big P is this amazing triad of Harvard Medical School, of Partners in Health, and Brigham and Women's Hospital. And Paul was the pivotal piece of all of those and brought those together. And as entities, we're all committed to that and ensuring that this goes on long term. Partners in Health is an academic NGO, and we're so fortunate to have amazing people who live in all three of these worlds seamlessly. I think when people often think, how does that possibly work to have people who are, get paid by the Brigham but work at Partners in Health and live and work in Liberia, and that's the easy part. The hard part is the work we do, these structures that we are in charge of changing and ensuring that they don't get in the way of doing what Paul would say of, what are you going to do to get it done? I'm really proud of our ability to work in these worlds, and I think that is what makes us strong. And it's not without its challenges, obviously, to have an academic institution, a hospital, and an NGO function to serve 8 million people every day and many, many millions more. But we do it, and we're very proud of it. And this is what Paul instilled in all of us. As part of my now I have the immense happiness to have a new colleague, and Vikram Patel and I were at dinner the other night and committing to each other and ourselves as our organizations that, Paul was so instrumental in all three of these places, and that will continue, because that's what Paul would want, and that's why we're able to do what we can. Vikram Patel is the Paul Farmer Professor and Chair of the Department of Global Health and Social Medicine at Harvard Medical School, where he also leads the Mental Health for All Lab and the Global Mental Health at Harvard Institute. He's been a leader in global mental health and contributor for the global health equity movement for many, many decades. He's the recipient of many awards and honorary doctorates and is a fellow of the UK Academy of Medical Sciences and the US Academy of Medicine. I'm very happy and proud to introduce my partner, Dr. Vikram Patel.
Well, thank you so much. So, what an amazing afternoon it's been. I almost feel like this is a revival and someone's going to get up and start singing. I think we're missing some music here, but maybe we will have some music after I finish my remarks. It's been an incredibly inspiring and moving moment for me. I only knew Paul for 6 years, and just to see what an incredible impact he's left on so many people, and I know this is only a small drop in the ocean of the people he influenced, is just overwhelming. It's incredibly humbling, especially that I now carry his name for as long as I'm at Harvard Medical School in the title of my job here. I also felt, sitting here and listening to this incredibly moving and inspiring remarks, and especially, Madame, your remarks were just incredible. It was a tour de force for me as an Indian to listen to your story from Haiti. I'm sure there are many differences, but there are also a lot of similarities as a post-colonial country. But it struck me as I was listening to these remarks that, at least in my mind, I seem to have crossed that invisible line of grieving with loss and sorrow that Paul was no longer with me, by my side, with us in our department, to actually a celebration, actually, that Paul will always be with us at every single moment of our lives. And maybe it's only fitting that we are celebrating Paul, for I also want to bring you greetings. Yesterday, 1 billion of my fellow countrymen and co-religionists, so even though I would say I'm secular, but still we celebrated Diwali, which is actually not a religious festival, it's actually a festival of light that ushers in the new year. And so on this Diwali, I want to start just by remembering Mahatma Gandhi's prayer to renounce violence and hatred and to embrace dialogue and reconciliation. I pray that on this Diwali, we can shine the light of love and compassion and celebrate the diversity and the dignity of all people in all parts of the world and respect their rights and freedoms. And I know that these are values that Paul completely shared and embraced. As I sat this afternoon listening to all the remembrances of Paul, particularly in the first half before the break, I'm sure this thought must have cropped up in some of your minds as well, but it certainly cropped up in mine. What must Paul be thinking as he watched us from there speak about him, think about him, remember him in different ways? I can only imagine, of course, that he would have been utterly delighted, that he would be watching us with that beguiling smile of his and that twinkle of mischief in his eyes that I think all of us remember, at the people and the institutions that he cared for so deeply, come together to reflect upon the role of a country that he loved so immensely, on his own journey, a journey which, it's clear, not only transformed his own life, but in doing so, also transformed our vision of global health altogether. That journey, I can now see, inspired and infused the field of global health with the power of action, of service, of activism, of course, of accompaniment, but most of all, I think of compassion. And not least, the very central importance of partnership, yes, with the big P. I did not know that, but now I will never forget it. These are the critical strategies of what we at Harvard Medical School champion at the heart of global health, scholarship and education. Without all of these together, we cannot achieve global health equity. And yes, Joya mentioned, I love that proverb, you can't eat gumbo with a finger. I think it's just brilliant. I'll take it back to India because I don't think you can eat any Indian food with just one finger. It's absolutely true that we at Harvard Medical School and our department will not achieve our goals without partnerships with you, with PIH. It's been a remarkable afternoon, and it only remains for me to thank the amazing team that has put together this phenomenal afternoon. This is such a high bar. You beat me to it. I was going to ask all the steering committee members and the folks at PIH and my department who have put this together to stand up, so then you can give them a real round of applause. I'd like to obviously also tell you, Sheila, and all our family and all our friends from PIH that for me and my department, you are an extended family. And that relationship will survive Paul's passing. In fact, I give you my commitment that it will only strengthen. For as I mentioned earlier, we share not just Paul, but we also share, very importantly, his legacy, a collective mission to realizing a just and healthier world. And so now I just want to invite you all to join us in continuing this celebration at the Elements Cafe, which is on the first floor. I know there will be colleagues of mine who will help direct us there, and very much look forward to seeing all of you at the Paul Farmer Symposium next year. Thank you so much.